Welcome to the Shared Value Initiative's 2020 Speaker Series. I'm Rima Jewett-Google, the Director of Engagement and Programs at SVI, and your host for today. For those of you not familiar with us, we are a platform of leaders that look to bring business solutions to solve societal challenges. We're a part of FSG, which is a not-for-profit social impact consulting firm co-founded by Harvard Business School professor Michael Porter and Mark Kramer. Now, typically, these series would have been in one leadership annual summit at the end of this year, but due to COVID-19, we've been gathering virtually and opening our events to the general public. So we thank you for joining us today, and we hope that you get to take away some key messages from today's conversation that will be helpful to you. A few housekeeping items before we begin. First of all, we are webcasting from our homes, so please excuse us for any technical difficulties that tend to crop up, and know that we are doing our best to resolve them as we go along. As you join the conversation, everyone in the audience is on mute and your cameras are disabled. So we'll have time for questions and answers at the end of the session, and you can use the chat function to pose those questions, which we will use the last 10 to 15 minutes. If you're on social media, please use these hashtags and handles so that we can further amplify today's conversation. And finally, we recently announced all of the other sessions in this series, and we invite you to visit us at sharedvalue.org to find out more and to register for them. Today, we'll be speaking with three fantastic partners of the Shared Value Initiative that focus on the global impact of COVID-19, which has exposed a broken system fraught with structural inequities. These companies and organizations have responded to the many facets of the crisis and understand the fundamental link between health outcomes of their employees and customers and their own corporate health. And those that have been successful are proving that agility and an openness to new ways of working help them to be able to meet the urgent needs with innovative solutions and partnerships. So let me introduce our speakers. Susan Beverly is the Senior Director of Sustainability and Shared Impact at Abbott, where she's responsible for developing and advancing the company's sustainability and shared value strategy globally. She is a member of the leadership team that launched Shared Value at Abbott, and it's the core tenet of the company's approach to business development in new and emerging markets. Susan has led the team responsible for building Abbott's inclusive supply chain program in India, as well as the company's more recent shared value strategy in Rwanda to drive localized product innovation, market access, and expansion. And she also leads the development and integration of Abbott's sustainability strategy, which focuses on the intersection between the company's long-term value creation and societal impact. Welcome to Susan. Gary Cohen is the Executive Vice President of Global Health at BD, a global medical technology company, and he also is the president of the BD Foundation. He's also a board director of UNICEF USA and the Global Partnership to End Violence Against Children, a board co-chair of GBC Health, and a board chair and founder of Together for Girls. He previously served on the UN Commission on Life-Saving Commodities for Women and Children, and is a board director and chair of the CDC Foundation. And he presently serves as the chair of the CDC Corporate Roundtable on Global Health Threats. Welcome to Gary. Oliva Lopez is the managing director of partnerships at the Rockefeller Foundation, where she works in the president's office to advance the organization's objectives through strategic partnerships. Prior to joining the foundation, Oliva worked at the intersection of government, private sector, collaboration, and civil society engagement in global issues, and contributed to the development and implementation initiatives to end global poverty, combat hunger, and empower women at the White House, U.S. Department of State, the U.S. Agency for International Development, and the Peace Corps. Oliva also advised entrepreneurs working to launch new ventures to promote gender equality. So welcome to Oliva. And Adib Mahmood is a managing director at FSG who leads our Washington, D.C. office and many of our engagements with corporate clients. He has a particular interest in global development and healthcare issues, as well as facilitating effective cross-sector partnerships, which was invaluable to the Shared Value Initiative in crafting this session today. He's also one of our faculty for our newly launched Corporate Purpose Learning cohort. And if people are interested in that, please reach out to him or to me at the end of this event. So with no further ado, I'm going to turn it over to Adib. Thank you, Adib, and thank you to all. Now we can hear you.
Great. Thank you very much, Rima. What a challenging, unusual, and significant time we're living through. Unfortunately, this pandemic is far from over. The global death toll is now almost 700,000. In this country, we've lost almost 160,000 lives. Of the 4.8 million confirmed US cases, many are suffering, even if they survive the disease. The personal toll is unimaginable. I was just reading stories about children who have lost both parents in quick succession to COVID, and I can't imagine what they are going through. The economic toll is unlike what any of us have seen in our lifetime. The unemployment rate may have come down a little in the last few weeks, but even as recently as a few weeks ago, it was almost 15%. I heard a quote on another webinar the other day, and the speaker was saying that we're all in this pandemic storm together, but we're not all on the same boat. And I was reflecting on how true that is. Some of us are on boats that are bigger, that are sturdier, with shelter, while others are on boats that might be leaking. We now have data that shows that this pandemic does not affect everyone in the same way, that based on your age, your income, and your race and ethnicity, you can be disproportionately affected. According to one UCSF study, if you're Black in America, you're almost 4 times more likely to die from COVID-19 than if you're white. Not 15 or 20% more, but 400% more likely to die. For Latinx populations, you're more than 2.5 times more likely to die compared to white populations. And this inequity is true globally as well. The UN Secretary General recently said that this crisis could trigger famines of historic proportions that could push 100 million more people into poverty. Now, the private sector has responded, from fashion and apparel companies redeploying their factories to make PPEs, to technology companies offering remote education solutions, to food and consumer goods companies offering emergency aid, and of course, companies in the healthcare industry jumping into R&D for medical cures, something that we're going to discuss today. There are many, many examples. But at the same time, after the immediate response, there's now an expectation and indeed an opportunity that the private sector can do more. And instead of me talking about these expectations, I thought I'd share with you 3 recent headlines that I read. Corporate America has failed Black America. Recent headline from New York Times. From the Wall Street Journal, pandemic could elevate ESG factors, environmental, social, and governance. Investors are asking more questions about social and environmental priorities. And from Fast Company, where a simple statement might once have been enough, companies that don't match actions to words aren't cutting it for consumers anymore. So here at the Shared Value Initiative and at FSG, we continue to believe that the principles that are embedded in shared value, identifying and working on significant social problems as business opportunities, taking a long-term view to impact, and collaboration can give companies a blueprint for creating impact. At the same time, we've been having a lot of conversations within FSG and the SBI about how in some cases shared value may not be enough, or indeed in some instances it may not be appropriate. So within this context, how have companies been able to move quickly? Has shared value offered a helpful approach for companies to respond to this pandemic? And how are philanthropic and other organizations partnering with companies to address the pandemic and the health inequity that we're seeing? Those are some of the questions that I am excited to get into as we engage with our 3 leaders and practitioners. I'm going to start with Susan. Susan, early in the pandemic, Abbott responded and launched the COVID diagnostic test. We saw that in the news. You personally have been championing shared value within Abbott for several years now, particularly on the importance of innovation and partnership. So did this practice and culture of shared value allow the company, allow Abbott to respond more quickly and effectively? And what role has partnerships played in that response?
All right. Well, thank you, Adib, and thank you for that intro. It's very interesting and also jarring. And thanks to you and SBI for hosting this important dialogue. I think when it comes to COVID and shared value, the shared value way of thinking has been at the core of what Abbott does and how we innovate for quite some time. So we've been thinking about social issues that are barriers to business, how we can help tackle social challenges around the world and also grow business in the process. So the way that we responded to the COVID pandemic has been no different. The pandemic has certainly magnified and reinforced the importance of collaboration and partnership. And I'm glad that you brought that up. That's really been fundamental to our ability to be able to respond quickly and effectively. And we've seen that in a couple of ways with our suppliers and looking at the resiliency of our supply chain, really thinking through how we're able to respond to demand. We've developed 5 tests in less than 4 months, and to date, we've delivered 40 million tests to 85 countries. So that's not something any company can do alone, and that's also not a level of impact that can be delivered overnight, also by yourself or even by starting from scratch. So thinking about sustainability and having that be core to who we are and being able to think outside of the box really allowed us to, I believe, respond in a very meaningful way. Our scientists worked 24/7 to develop our 5 tests. And so developing a test, you can imagine the complexity that goes along with that. And during a pandemic where you need to do most of the work virtually and also with social distancing was extremely difficult. But through partnerships with customers, regulators, suppliers, and internally and kind of thinking about our value chain and how we deliver most effectively around the world, we were able to actually respond. And so we knew we needed to respond quickly to think about communities and frontline healthcare workers, families, and that really has driven our innovation and our delivery in communities around the world. We also built our response on an existing testing platform. So we are a leader in infectious disease testing, and we were able to use that platform and build the COVID test and then work with existing suppliers and also have quick access to new suppliers to be able to get the products and supplies that we need to meet demand. So I would say, we've always thought at Abbott that shared value partnerships are core to delivering successfully, and finding the right partner, trusted partners, is key. And we've certainly seen that come to life in our COVID response. And then also around just challenges with the health system. And certainly there have been issues that we all know that have been magnified throughout this process. And part of our response goes beyond testing to how we engage in communities and how we reach the most vulnerable. And we've only been able to do that through some of our partnerships. We have one with Direct Relief, where we partnered with that organization to deliver $5 million to 25 U.S. health centers in the U.S. And these are in predominantly Black and Brown communities, and it focuses on testing, triage, delivering quality care. But again, being able to move quickly meant that we had an existing partnership with Direct Relief, and that we're able to bring all of our expertise to solve this problem. Our belief at Abbott is that health disparities, it's universal, and I think it's really been magnified in the U.S. of late. We believe that access to quality care should not differ based on where you are in the world. And I think for a while, there's a lot of discussion about these issues being in emerging markets or looking different in emerging markets. And for us, applying that shared value approach and thinking to respond in the U.S. has been critical, and really tackling those injustices that come along with lack of quality care. And, we believe at Abbott that we have a role to play in partnership with others. And that really is the essence of shared value.
Thank you, Susan. And great to hear how some of the ways of thinking from before, when it comes to thinking about integrating with your business, thinking about why partners are important, allowed you to, in many ways, naturally flow into responding to this situation because you had existing partnerships and you had that way of thinking. So that's really interesting to hear. Gary, let me turn to you. In early July, BD launched a new rapid portable COVID-19 test, one that the company says will dramatically improve access to testing for COVID. And before that, you also have launched a product for testing COVID antibodies. You've been able to get these products to the market quite quickly after the pandemic hit. And we know that BD has been practicing shared value for decades now, even before we were calling it shared value. What enabled you as a company to move so quickly? And can you also share with us what are some of the changes that happened inside the company in terms of processes and thinking that allowed you to mobilize and reorient yourself?
Sure. Well, thank you for the question. And again, and thanks for Adib and Rima for this opportunity to participate today. First, I just want to start by saying that I think that what's happening now globally with COVID-19 is probably the most significant shared value opportunity or experience in modern times and maybe in history. And the reason I say that is so many companies across so many different industries are now practicing shared value creation. The key question is whether or not they realize it. But what they're doing is they're dealing with among the most significant health issues and societal issues, because it's gone beyond health. We know that it's affecting employment, it's affecting racial equity. They're dealing with those issues by trying to figure out how they can deploy their capabilities to have positive impact, as well as to enable their own survival. And in many industries, it is a case of survival. So this is a truly unique time, in my opinion, for shared value creation as a concept. But I would argue most companies aren't seeing it through that lens. They're responding more instinctively to what's going on, but not thinking about it analytically. I would say for BD, I appreciate your comment. We have been practicing shared value for many decades before the term was characterized. And for us, this has been an all hands on deck experience, and it triggered the most rapid and substantial reorientation of our work and our resourcing and our deployment that I've seen in the 37 years that I've been with BD. And our response is very broad. It's I'll talk in a moment specifically about diagnostic testing, as Susan did, but it's far broader than that because BD is a fairly diversified company in the healthcare space. So there's many different areas of COVID-19 that we became relevant to and became relevant to our response. So first was expanding testing. I'll come back to that. We launched a new infection control training program in the midst of COVID-19 to better prepare health workers for the changes in the environment. We're vital to the supply of intensive care units, so ensuring continuity of supply of things like infusion pumps and catheters and other things, particularly during the peak of the intensity of ICU work when patients were being put on ventilators with COVID-19. We also have a unique data system in the US being used in over 400 hospitals that has real-time data on COVID-19. And among other things, we're supplying that data now to and have been for a number of months now, to the CDC. We're working with companies that are developing new therapeutics and vaccines through our life sciences unit. We're helping governments prepare for mass vaccination by ensuring that we will be able to provide supply and capacity for vaccination devices. Often people focus on the vaccines and overlook the fact that you have to have devices that deliver the vaccines. We had been helping stand up the field hospitals that went up in many different locations during the peak of hospitalization. And this requires, just as Susan said, collaboration across sectors. So we're working closely not only with governments, but also with global health industry agencies on the global response. And then our largest philanthropic program in the company is actually to strengthen community health clinics, whether they're federally funded or free clinics. And we've amped up that work substantially because of the issue of inequitable access and the points you raised about racial inequities. So all those things have been going on pretty intensively since starting late February. And it's been a true reorientation. Some of our business, by the way, has been impacted negatively by COVID-19 because we make products for elective surgical procedures, and I'm sure you know that's way down. So we've had to reorient the way the company works around this. And it's been, as I said, all hands on deck. Very consistent with what Susan described about Abbott. Our first response on the diagnostic testing side was to develop new PCR tests or molecular tests that are being used on an existing platform we have called BD Max. It's an open platform. So first, we work collaboratively with other test providers to adapt their test to our platform. And then we also introduced our own version of that PCR test. And for those in the audience who are listening, a PCR test is the gold standard for accuracy. It can typically only be done by a central laboratory, a sophisticated lab, and it takes at least hours, and if not longer, to get the result. And one of the factors with diagnostic testing that's inhibited the impact of diagnostics on COVID has been the time to result in the fact that the samples have to go to a central lab and then back to the clinician, the doctor, and then back to the patient. So just as you said, we launched last month our first point of care antigen test. And the antigen test is a point of care test that could be done in a doctor's office, in a pharmacy, in a clinic, in a long-term care facility, and it gives you a 15-minute result. And the accuracy is close to a PCR test. And this is critical because unless we can get the time to result very close to the time of testing, you lose much of the benefit of diagnostic testing because if a patient is infected, they will still be potentially transmitting COVID-19 virus during that time that they're waiting, or if they're not, and it may inhibit their ability to return to work. And the antigen testing is in great demand. And now it's no surprise we will supply everything we can make, and we've done a lot to ramp up capacity. The other good thing about that test, it also works with an existing small handheld instrument called BD Veritor. There are 25,000 of these instruments already existing in the US. So as these tests are supplied to work with that instrument, they can go into use immediately. And one of the things that was recently announced is we've received some funding from the US federal government to more substantially scale up our manufacturing capacity for those tests. So we also did introduce an antibody test several months ago. That was at a time when there was not any regulatory approval required for those tests. Subsequent to that, the FDA required a EUA or emergency use authorization for those tests. At that point, we withdrew that test because we were working on a second generation version that's now being reviewed by the FDA for an emergency usage authorization. When we developed the antigen test, that was done in a start to finish. And keep in mind, these are not just brand new to the world tests. This is a brand new to the world virus. So it's literally starting from scratch. And that was done start to finish in approximately 4 months. Normally that would have taken well over a year. We had to test and validate over 150 antibody pair combinations to ensure we got the best clinical performance with that test. And we literally had people working around the clock, 24/7, without exaggeration, weekends, nights, to enable this to happen. And of course, for good reason, because of the urgency of this circumstance with COVID-19.
Great. Thank you, Gary. And I'd like to come back to your very interesting point about this being the greatest shared value opportunity that you've seen. I think that's going to be something we'll want to dig into a little bit further. But Oliva, let me turn to you. The Rockefeller Foundation, of course, as we know, engages in its own philanthropic activities and has continued to engage. But you also engage in partnerships, and you're leading partnerships there. Can you share with us and the participants how you've engaged in partnerships and the role of partnership in addressing this pandemic? And in particular, since we're talking about companies and shared value, what do you wish that companies were doing more of or doing differently that you think would enable you to partner better and create greater impact?
Well, first of all, thank you so much for the opportunity and for the invitation. It's wonderful to be part of this conversation. You know, the COVID-19 crisis for us has been a learning opportunity, and I think it's been the case for everyone. We know that complex social problems like a pandemic are not just going to be solved by one team or one group of people. We know that it requires a multidisciplinary approach, and because of that, our response has been built in that way. And so we built our team, our response team internally that way. And we knew from the beginning, it was evident that this was going to be impacting low-income communities, vulnerable populations. And so we also brought this equity lens into our work. And so we were conscious that social determinants of health were going to be, because of that reason, you know, potentially communities of color, essential workers were going to be most impacted by this. So we focus on first an immediate response approach, what needed to happen in the first few weeks. And then we look at also, as we were working on an immediate response, what needed to happen over the medium and the long term. And so we built a holistic approach. It's all of our teams. It's not just the health team. Obviously, they are leading the work, but we also brought in our equity and economic opportunity team, our food team, and in the case of our more global work, we also brought in our power team, because obviously, if you're in a clinic, you know, you need to keep the lights on. So it was really also an all hands on deck approach. And for us, as I was talking about sort of how do we approach this, we divided our response in sort of what we were going to do domestically in the United States and what was going to be the response on a global level, and how were we best positioned to do that. And just to talk a little bit more about sort of how we approach the work in the United States, we looked at what needed to happen in the short term. We went out, and if we didn't have the capability, found the partners who can help us do that. So we knew from who was being most affected by this crisis in the beginning that food security was going to be an issue. And so we went out there, and our food team basically started forming partnerships with organizations that were providing meals, for example, children who were out of school and who relied on meals through their schools. So we formed a partnership with some of the nation's largest school districts to make sure that you know, children would still have access to food. We've noticed as well that if someone, you may remember in the beginning, it was very difficult to get tested and have results in a prompt manner. So a lot of people were getting sick, and a lot of people were being asked to stay home, to isolate. And again, that put pressure on families that relied on a person to earn money to put food on the table. So we formed partnerships with organizations that had a national presence. The Rockefeller Foundation doesn't have offices all over the country. And so for us, it was important to look at who is in a position to respond. So we formed partnerships with organizations like the United Way, who had a national presence, who through their local chapters can let us know what was needed in real time. And we were able to also pilot new approaches, new ways of doing things. And so, for example, with United Way, they devised a pilot opportunity to work to deliver food for people who were isolating, who have been diagnosed, and who needed access to food. And so there's a program to deliver food to vulnerable populations. And so once we started sort of taking care of the immediate needs, we went on to sort of what needs to happen next. And in the United States, it was evident that we needed to find a way to safely reopen after we went on a lockdown. It was going to be important to be able to get back to work, but do it in a way that it was safe and that it was conducive to reopening our economy and hopefully making some gains. And so that's what led our team to focus on developing a national testing action plan. This was the combination of both of our health team and our equity and economic opportunity team, as well as others in the foundation, to figure out what was needed in the absence of a national strategic plan. What could we do to share best practices, share the best science out there, and come up with a plan. And so that's what we did. And in doing so, we really took this approach of convening and bringing different stakeholders together that might not necessarily be talking to each other. They may not know that they need to talk to each other, but because the Rockefeller Foundation has a trajectory, we have over 100 years of experience. I think we are a trusted organization. We are a neutral partner, and so we can bring different sectors to the table. So we can bring governments, we can bring nonprofits, we can bring the private sector, and we can promote that dialogue and have those conversations that lead us to developing solutions. And so that's what we've been doing since the beginning of the pandemic and here in the United States. And we're very proud of the work that we've been able to do. Some of our partners are also here on the panel as well. And so we've been able to play a role in sort of making sure that if we see something that is not being addressed, we bring together the right set of partners to the table to make sure that we can address that. And just recently, we revamped our National Action Testing Plan, and we just recently also announced a collaboration with different state governments from different sides of the aisle to just make sure that we can facilitate the procurement of tests and other inputs needed to make sure that as we continue to respond to this, that that we can do it in a way that will be hopefully conducive to reopening on our economy. And on the global space, we again look at what was most needed. We couldn't necessarily respond to the needs of every single country, but we do have presence in Africa and Asia, and so we focus on the existing relationships and the partners that we have there, and we're bringing that science-based approach as well, and figuring out where are the gaps, where are the opportunities, and really bringing our expertise and our power of convening to address those problems. And I think you also mentioned sort of what do we wish that companies were doing differently, and I think we've been very glad to see the response. I think this has been such a traumatic event for everyone, and I think that it's really been great to see the private sector jumping in. I think that it's not necessarily that we're not doing this, but I think obviously we could always do more, and that is aligning around shared goals. We have done this with the testing, with the national testing plan, but I think when it comes to also addressing the needs of the vulnerable populations and the people who are most affected by this, we have been involved in understanding the root causes of systemic inequity. We've been building strategies. We have been working with grantees who've been doing great work to solve these issues. And so we think that we can offer insights, we can offer needs assessments, gaps, and opportunities to companies that are interested in being part of the solution. And so what I would invite others who might be part of this audience is to think about how nonprofit organizations and foundations who have many years of expertise and experience can help you develop a strategic approach to your response, and to also think about not just what you do in the first few weeks or the first few months, but also think about the role that you can play in addressing systemic change. And we, I think, are always happy to share what we know and make connections and bring people together.
Thank you, Oliva. And yeah, thank you for that call to action to all of the companies who are listening in to reach out to you and other philanthropic and nonprofit organizations who are doing great work around the globe and around the country for partnership, for data, for insights, for co-developing programs. I think that's a very practical suggestion. What I'd like to do is ask a couple of questions to the panel, to each of you. Anyone feel free to jump in. Also, we have already gotten some questions from the audience, but to all of those of you listening in, please do send in your questions. We won't likely be able to get to all of them, but we absolutely want to hear from you, and we'll get to audience questions in a few minutes. One question I'd like to ask each of you is something that, Gary, you started mentioning earlier about the shared value opportunity at this time. And each of you, whether it's Susan or Gary at your respective companies, or Oliva at the foundation, you've either been practicing shared value or you've been, in the case of the foundation, supporting the shared value initiative and encouraging shared value and partnering with companies. Has your approach to shared value and how you think about shared value, how you think about the opportunity, has that changed as a result of this pandemic and this crisis? And if so, how?
Well, maybe I'll jump in and just reinforce that I do think this is a very unique time for shared value creation across all industries. And one of the things I noticed first, because I think we all have to be students more so than teachers, so I try to observe as much as possible, was that the advertising industry was among the first to adjust or to change. The ads that you would see on television shifted to ads that were relevant to COVID, and they did so across many different companies. So I think the ad agencies were very responsive and on top of things. And there were some that I found to be highly credible, such as the ones from the supermarket chains indicating that their workers work on the front line and are valued and are at risk because they're doing so. And then there were others, some of the car companies saying, we care about you and your family, so we're offering low interest financing for the next 3 months that were less credible in my view. But it was indicative of the fact that the agencies were pushing the companies to say, look, this is what's going on now. You have to respond. I think for the most part, industries have been responding in a beneficial and positive manner. I think many of them have been doing so out of necessity. You look at the airline industries with their cleaning protocols. I mean, they're getting hurt really badly right now. So I think if you look across industry and then the companies within those industries, you'll be able to see how much change has been required in a sense because of COVID-19. On our side, I'd say, as I mentioned before, that there are things that we do that are extremely important and relevant now, and we reoriented around those things. And then we had to, by necessity, dial down some other things that are not as relevant and important now. And I think even within BD, a company that's been active in shared value creation now for decades, as you said, we were the first company that did specific shared value training among our leaders, and about 500 of our global leaders back in 2012, 2013. Yet I would say most people, even in the company now, are not thinking about, well, I'm doing this because this is consistent with the principles of shared value creation. They know there's an urgent societal need that has to be fulfilled, and we're deploying ourselves to fulfill it. And I think the key question, even for BD, and more broadly, I would say for companies that might not even be familiar with the concept of shared value creation, is will this be sustained? Will they see that engaging in this way makes them more relevant, more valued, endears their customers to them because they're seen as being responsible in society? Will they build upon these practices? The way I've heard Michael Porter talk about Walmart after Hurricane Katrina, they mobilized a whole series of things. They say, wait a minute, this really enables us to have a stronger relationship with our customers and our community. So it was sustained there. Will companies that are responding now be able to sustain it? Will they realize why they're doing this and the impact it can have? And it's also, in my opinion, an opportunity for the Shared Value Initiative and FSG to bring it to light that this may be a more effective way of doing business because of this crisis. Or, as human nature often causes to happen, once the crisis is gone, will people go back more to their traditional behaviors?
Yeah, and I love that, Gary. And I think, the only thing I'll add is that there's really an opportunity to think about the most vulnerable. And I feel like a lot of businesses across sectors are trying to figure out how to make impacts in communities through business, through true business solutions. And, at Abbott, we're now setting our 2030 sustainability plan. And we started to talk about, we were in the midst of creating this plan, then COVID hit, and the racial injustice issues that have come up. And we've talked at the highest levels of the company about how do we take on long-term ambitions and really think about underserved communities and remote health delivery. So we've really started to turn some of our thinking and approaches, on their heads and start to come up with longer-term sustainable solutions. So I think I agree with Gary that we're not always looking through the lens of shared value, and what we're doing is innately addressing this huge societal issue, and it needs to be sustained moving forward and also continue to push that innovation, that urgency, that partnership into coming up with new solutions that will benefit us all in years to come.
And I would only add that for us, it just reinforces the need to continue the work. And so I may agree with what Gary and Susan just mentioned. And so to the extent that we can continue to be a platform that supports these kinds of dialogue and sort of bringing practitioners together, we welcome that opportunity.
So, Susan, to pick up on what you just mentioned, having conversations within Abbott about those who are most vulnerable. And this is actually something that all three of you mentioned in your opening comments about, the disproportionate impact that I mentioned, the inequities, the most vulnerable. We have heard many social sector leaders, whether they're philanthropic leaders like Darren Walker and corporate leaders like Ken Fraser, who's the CEO of Merck, one of the very few Black CEOs among large companies, call on companies and foundations to do more to address inequities. And in many cases, what companies and foundations are doing may be helping, but also may not be, because we're all working within a system that has for hundreds of years promoted inequity and structural racism around the world. Can you share a little bit more about how that conversation is unfolding? It's clear that you're all talking about it internally, but how is that unfolding? What are some of the lessons, and where are you getting stuck? Like, where are you struggling in talking about how to take an anti-racist approach as an organization?
Yeah, I mean, I can start. I think that, one of the bright spots of what we're going through now as a society is that we're starting to talk about structural racism and inequities in a more transparent and meaningful way. So I've not seen this level of dialogue and openness to actually addressing the issue. We've all known that it's existed, and I think as COVID took off, it's not a surprise that Black and Brown communities are disproportionately affected, but we did not have the systems and programs necessarily in place at a broad level to really enact change. So, for us at Abbott, we've been working to address health disparities for quite some time. Many of our programs have been in at-risk communities. They've taken a more philanthropic approach, and I think that work has been phenomenal. It's been transformative. The opportunity moving forward is thinking about how do we weave in shared value and how do we really start to think about this as a business strategy. And, we've done a lot of reflecting. We're working to learn and meet with others. My view is that we don't start to have this transformative work during a pandemic and on the heels of extreme racial injustice with the flip of a switch. That it takes some time, but we also don't have a lot of time. And so it's figuring out how to balance that urgency and coming up with meaningful response. I think Abbott, like most companies, we wanted to immediately respond with our expertise and our science and our testing. And then when it came to community, how can we support the communities in getting what they need in order to help save lives and impact communities in a positive way? Now it's about the transformative change and really looking at the ecosystem, and are there models that we can be creating in partnership with others to transform community health? And one program that we've been working on for about a year now in the city of Stockton with Mayor Tubbs is called Future Well Communities. And we're looking at social determinants of health and actually really pressure testing those issues and biases and how we've been doing things. And can we create a really innovative model that can exist in Stockton, which is, I think, recently labeled one of the most diverse city in the U.S., and take that into other communities. So coming up with innovative models in partnership with others that actually transform. It doesn't take one lever of the ecosystem or one piece of change, but looks at what's transformative, because that's been, I think, the hardest part for me during this pandemic and a lot of the racial injustice is that we just don't, the response isn't there. And so we're taking a step back and thinking about how can we be more intentional and how can we really embed this in our strategy in a meaningful way.
So Adib, maybe I'll jump in. I think that the sad reality, and it has been for some time, is that when there are serious problems, they find their way to the most vulnerable, and that's where they have their greatest impact. And, with respect to COVID-19, white Americans represent 57% of the US population, but only 13% of those who have died from COVID-19. Hispanics are about 20% of the US population, but they represent about 35% of the people who've died. And non-Hispanic, non-white, which would be primarily African Americans, 22% of the population, but 30% of those who've died. And it's not surprising, because what underlies this is those population groups are much less likely to have adequate, if any, health insurance. That impairs their access to health services. They're more likely to have jobs that don't allow them to work from home. And they're less likely to be able to take paid time off from work if they're sick. So they're put inherently into a more vulnerable situation. Then converging with that was the murder of George Floyd. And I can tell you, we've never had as much open, sincere, and I would say constructive but painful conversations in our company as we've had since the George Floyd murder. It's opened up, I can say, the most honest conversations that we've had about society in general, about racial inequity. We've run webinars specifically internally on health inequities and COVID-19. And I do think if we use our collective wisdom, those will lead to more positive changes. And I've mentioned, we had a pre-call just to prepare for this, that I do think in general, companies, particularly global companies, are more progressive with respect to racial equity than society at large is. And because we have to be, our global workforces are diverse. We want them to be more diverse, but we would not tolerate disharmony within our own organizations. You can't operate that way. And that's evolved over time, in my opinion, to the point where there is truly a culture that is more conducive to equity within large companies. Susan may have had the same experience in Abbott. Doesn't mean it's perfect, but if you compare that to society at large and look at all the fractionalized activities and issues that are going on more broadly in society, I actually think global companies can continue to have a positive impact on this. And people may be skeptics of that, but once you get inside a company and see what the culture and the policies are, you can see that they definitely are much more so in the direction of equality, in my opinion, than you see in society at large. The other thing I would say is it's so important to build up the capacity to provide health services to reach those who are underserved. And as I mentioned briefly before, this is actually our largest area of philanthropic commitment. We're going to be making another commitment next Monday at a virtual bell ringing of the New York Stock Exchange, and together with Direct Relief, which was a nonprofit partner Susan also mentioned. I don't know if a virtual bell actually rings. We'll find that out on Monday, but there'll be another commitment made, because this is one of the ways that we can act quickly to address some of this disparity. We also made a commitment to the Equal Justice Initiative early on, following the murder of George Floyd. So these are things that are difficult in society that hopefully we're learning from, we're adjusting to, and we're getting greater proportions of the population, whether in the business sector or other, how important it is to address these inequities.
And I would say from our perspective, for us, Rockefeller in some ways was already, we were actually already working on these issues. We had just prior to COVID launched a new equity and economic opportunity initiative, and we were prepared to do even more work in this space. So when COVID happened, I think the fact that we had that trajectory of work and those relationships with a lot of these organizations and grantees and communities who were telling us what they needed, and we had done all the analytics and all the convenience and the engagement, we knew that. And so it informed how we respond to COVID. It informed how from the beginning our response to COVID had that equity lens, and in a very conscious effort to make sure that vulnerable populations were getting the help that they needed and were getting access to testing and other supports that they needed to get through this pandemic. And so in some ways we double our efforts, and it was helpful also to have those existing relationships and that trust in these communities as well, to allow us to then also launch new programs and to say, look, contact tracing can be very difficult in some of these communities. There might be lack of trust, and so it's helpful to already have those inroads with those communities, because they can also help you inform how you build your response, and how do you perhaps tweak a program, something that work in another place, but in this community we have some special challenges. So let's talk to members of those communities, or let's talk to organizations that serve those communities, and they can help us inform and really tailor the response to them. So that has been very important. And so we continue to build on those relationships, and we continue to, our work continues to be informed by that. And I made the point previously that we focus on what's in front of us, but we also think about what's coming at us. And so we're very focused right now also on the testing, but we also know that eventually there will also be a vaccine, and we got to think right now, what is the infrastructure that we need to have in place as well, to make sure that when those vaccines and those cures are available as well, that they can be available and distributed in an equitable way, and that continues to be part of our work. And just on a sort of on a more sort of organizational level, we've all been having the conversations that Gary was referencing, and they're difficult conversations, but they are important to have. And for us, we're very fortunate that we have a very diverse team with people from all corners of the world and from all over the US, because of the nature of our work and the global trajectory of our work as well. And so it's been very inspiring to see the conversations and the dialogue that we have, and we intend to continue that.
Adib, let me share a couple other quick thoughts, if I can, on the question you asked, unless you want to go to the next question.
Actually, yeah, Gary, let me just ask, you can see if these questions relate to what you were going to say. I'm going to combine two questions here, and I'm going to start with the real easy questions first. The first one is, when you consider equity and access, how can the health industry provide tests to all countries, not just to rich countries who can pay for the test? And another easy one is, are there discussions happening on rethinking how healthcare in the U.S. is delivered versus, an individual company approach? So, probably won't have time for each of you to answer both, but maybe you can pick one of those to talk about.
Maybe I'll jump in and I try to answer both quickly. First, I think it's the intention of all the companies that are producing diagnostic tests to supply them as broadly globally as possible. One of the challenges we're facing right now is we can't possibly produce enough yet to meet demand. At some point, those two curves, if you will, should meet. But we're already working with the global health agencies to understand what the demand is, what the needs are going to be in developing countries and emerging countries. Fortunately for many developing countries, there's great organizations like the Global Fund that are very engaged in this work. Gates Foundation is engaged. Foundation for Innovative New Diagnostics, which is based in Geneva, is engaged, and we're working with them collaboratively to help plan this out, and with agencies such as the Africa CDC. On your second question, this is what I was going to say before. If there was just some way that we could look at healthcare as a policy issue, but not a political issue, and this may be a little bit of pipe dreaming, but healthcare policy is absolutely relevant to healthcare, but unfortunately what we've done is we've politicized it. Likewise, we were with COVID-19 politicizing the wearing of masks, politicizing whether or not economies should open up compared to whether or not people should stay socially isolated. These are all valid issues, but when we go from policy to political, we change the motivation that underlies people's viewpoints and actions, and we create division instead of unity. And if there's one hope that I could have for the health system in the US, which has many, many flaws, particularly with respect to access, is that at some point in time, we can look at it from a policy perspective and figure out what's reasonable, what works best. It's not reasonable to have millions of people who don't have health access. And if people didn't believe that before, now, with the circumstance of COVID-19, where people who have insufficient access not only represent an issue for themselves and their families, they represent one of the vectors that is going to continue to cause spread in society. It's in everyone's interest to extend health access to anyone who needs it. If we can look at that from a policy perspective rather than a political perspective, maybe we can make more progress. And it's a very important issue for us at BD. We absolutely are in support of health access at all levels.
Yeah, and I'll just build on that last point around, kind of U.S. health system and policy. Policy extremely important. I think that business has a role to play to also help push and drive. And some of the, really innovative programs that we've been able to partner with other governments and countries around the world to build, just using that same level of intentionality and energy and innovation to try new ideas here. I think that we can, despite all the barriers that exist and the challenges that we have ahead of us in the U.S. health system, with the U.S. health system, I think that we can innovate and we can partner with each other and also just start to drive change like we have anywhere else in the world. And on the question around testing and not just to rich countries, I don't have much to add beyond what Gary said, because that is the reality for most MNCs and certainly diagnostic companies. But it's testing and so it's getting the test where they need to be, making sure that people understand if they're infected or not, but also the training that goes along with healthcare workers. And one of the programs that we're currently have going on in Africa on the continent is that with the African Federation of Emergency Medicine, and making sure that emergency care specialties and expertise are where they need to be in order to respond to the pandemic. And so through training and webinars and virtual learning, just making sure that the healthcare staff and workers in these countries are equipped so that when the test comes that we actually know how to use them, how to deploy, and how to provide quality care. So sometimes it's good to think beyond just the test and kind of what else is involved in that ecosystem to really drive health and change.
Yep. One other question in the remaining few minutes that has come in is about pre-competitive collaboration. And so two people have actually asked whether this pandemic creates an opportunity for more pre-competitive collaboration between companies, and whether there are any new ideas or insights about collaboration between companies who might be competitors even that have come about.
I think that certainly there's more partnership. We've seen some of it come to light in various industries. I think in health, there certainly is opportunity to think about how we can work better together. Abbott's a diversified healthcare company similar to BD, so we have diabetes and vascular products, and just thinking about once we're able to really take that step back and think about the full spectrum of health and where we have the best expertise and where we can partner with others to really drive that change. And particularly in underserved communities, I think that's where these partnerships can become quite effective. So we hope to see more of it and be a part of more of that.
Yeah, I think the pharmaceutical industry, more so than the diagnostic industry, has for a longer period of time been more engaged in the pre-competitive collaboration space. You'll see more of that type of activity between, let's say, smaller biotech companies or life sciences companies and big pharma companies, and sometimes even between big pharma. It's a little bit less so in diagnostics, but it is occurring in some areas. Some of the tests that we introduced on our PCR instrument platform were actually coming from different diagnostic companies that were developing tests for use on our platform. One thing that has to be done is you have to have a very clear, strong, solid line between activities such as that and anything that might be considered something that could create an antitrust issue. And so companies have to be very careful about how they collaborate with each other in very clearly defined spaces. Certainly philanthropically and philanthropic activities, they can do so. On research activities, they can do so. Whether or not this will open up more opportunity for that type of activity, I don't know yet. It's hard to say. I think most of the innovation that's occurred to bring tests rapidly to market for COVID-19 were being done within companies and their existing collaborators, as opposed to across companies.
Yeah. Well, we are almost out of time. This has been extremely illuminating. I think the comments about how you changed how you think about opportunities, partnership, connecting with those that you may not have connected before, thinking about demographics and equity in many of its different forms, and the difficult but honest conversations that you all are having internally, especially within companies where it isn't always the norm, is great to hear about. Can you all take a minute to share any last thoughts or advice with either for other companies or collaboration before we close?
Sure.
Yeah.
Sure. I'll start. I think I love the conversation today, and I really want to reinforce the messages around this is a unique time for all of us to think differently about the way we run our businesses, what we focus on, who we've left out, and how we really start to think more strategically about growing our business and delivering value, not only for our shareholders, but also in communities where we operate. When it comes to health at Abbott, we believe that you really need to disrupt the ecosystem, think outside of the box, and really just encouraging across sectors, companies to think about that. What can we be doing differently? Now is the time. There may not be another time where you really have that freedom to push, and we have society and business and government kind of all rallying around a similar issue, and coming up with the right approach to drive transformative change is key. And also just taking what we've been doing outside of the U.S., bringing it into the U.S., and vice versa in many cases, and really just not relenting and letting this moment pass us up.
And to build on what Susan just mentioned, this is not, it is a very difficult, complex problem that we're dealing with, but we have to believe that we can fix it and we can address it, and that it requires all of us working together. And so everybody's doing their part, the private sector, health companies, the philanthropic sector, everybody is doing their part. I think for us, we are always happy to serve as the coordinating sort of platform for all of these efforts to come together and sort of together be more impactful. So I would encourage those who are listening to us to reach out and think about how we can work together.
And I'll just say that, we have a virus that's causing huge issues everywhere in the world, illness, death, economic dislocation. We have racial inequities reaching a boiling point, causing protests to happen throughout the world, not just in the US, but throughout the world. We have extreme weather events. I, have had no power in my home or cell single or Wi-Fi for 3 days. I had to go to my daughter's house to be able to connect into this webinar. Maybe there's a message in all this, and maybe we need to get the message. Maybe we need to focus more on solving these problems and these inequities, and I would include within that the environmental damage that's been caused. If nothing else, the earth is getting a little bit of a break now. We wouldn't want it to happen for this reason. Maybe there's a message in all this, and that's what I really admire about shared value. Is shared value says, this shared value principles say, take your capabilities, point them towards to accomplishing good in the world, and guess what? If you do that really well, you'll be more successful. And I truly believe in that. I think we've had the experience with that in BD. Maybe we all need to get the message, think a little bit less about what's in our own minds and our own needs, think more about what our communities need, what our planet needs, and how we can solve these big problems.
Well, with that message, I want to express our gratitude to our three panelists, Susan, Oliva, and Gary. This recording will be made available to everyone who registered on the Shared Value Initiative website. We'll also send it out to actually it'll be available for everyone, and then the registrants will receive it. We'll send it out. Our upcoming sessions are also available on the Shared Value Initiative website. So that website is sharedvalue.org. Also want to thank the entire SVI team, in particular Rima Google, who worked very hard to put this panel together, Alicia Dunn and Georgie Eckert, who worked tirelessly behind the scenes to make sure that these run smoothly. And to our participants, we had close to 700 people register for this. If you're working on these issues and you want to share your ideas, you want to share examples of what you're doing, please engage with us. And thank you for your time today. Thanks, everyone.
Thank you.
Thank you.
Bye-bye.
Bye, everyone.
Bye-bye.